Hello, my name's Vanessa. I am a movement therapist, and today we're going to talk about how holding tension in your core, in your back muscles, in your obliques can cause pain and that feeling of restriction. Now, without getting into your low back and really massaging it, there are other ways that are a little bit more gentle that can help you to reduce your pain and actually increase your movement capacity. So sometimes really digging in and getting that massage can cause you to be sore for a few days after because you've had a lot of trauma to the area. But if we want to reduce that trauma, create change pretty quickly, so if you're feeling like you want to do a workout, you want to do more movement, we can do this straight away. And this is because sometimes there is a bit of a unbalance of tension between certain muscle groups, maybe in your fascia, that we can rectify with a few different things. And so your core or your muscles, for all that matter, never actually really turn off. If they turned off, we would be in a pretty dangerous state. But we have levels to how much we need our muscles to be turned on at rest and how much we need them to be active and how on we need them to be. And so if we think about the levels of just a 1 to 10. So at the moment, me sitting upright, I have to fight gravity. So I have to, work relatively hard, not super hard, but I can't be completely relaxed. If I was completely relaxed, you'll notice my posture change. Now my belly is kind of more relaxed. The muscles can be turned down more, like the volume, because I am not lifting myself up against gravity. When I choose to lift myself up against gravity, then I engage more. Why is this important? Because our posture and the way we hold ourselves against gravity is quite subconscious, and it's really related to our mood, how we're feeling, and how we're experiencing the outside world and our internal world. So if you think about feeling anxious, if you think about how that feels in your body, anxious feels stiff, guarded, protective, kind of held away from something. If you think about anger also feels quite stiff, but maybe in a little different way, maybe in a more powerful, slightly more forward way. And then if you think about sadness and pain, it feels really inward and different types of tension. And the way that you feel and how you're thinking and what's happening to you in your external world is going to change how these muscles respond to your posture and to your mood, and therefore how on they need to be or how on they think they need to be. Now, quite often, if we're in a pattern of anxiety or if we're at work and we're stressed, we can have this kind of holding pattern where, and again, quite common, you're holding your belly in. It makes you look slimmer, or you may be a bit self-conscious, so you kind of hold it in. And then, someone tells you something stressful at work, so you brace, and you're not actually really aware that you're doing this. But what happens is then all day, you're sitting in the car and you're tense because there's traffic, and all of this is turning on and on and on and on. And then before you know it, you're really stiff and you can't move very well. And that stiffness can appear in your back, that stiffness can appear through your sides, maybe it's in your neck, wherever it might be. But what we can do is we can start to turn down those signals so that we're allowing this to move a little bit better. So how do we know if we're on or if we're able to turn those signals down and dampen them a little bit? So before we move to the Pilates balls, just take yourself down to the floor, and coming into this bent knee position, I want you to try to relax your body as much as possible. And you're going to give your belly a bit of a poke, okay? And your belly should feel soft at rest. So it should feel like, not even like a sponge, like really floppy Play-Doh that you're able to kind of manipulate and pull around. And as you're kind of pressing in here, if you notice that there's tension spots, are you able physically in your mind to connect in as you use your exhale? Can you soften those down? Can you let it go? Now, for a lot of people who are in chronic anxiety, chronic stress, or chronic pain, that letting go can feel quite challenging. It can be really difficult. And sometimes you're not even sure what you're feeling. And so even if you have a stomach that is able to be turned down, or these core muscles are able to be turned down, you're not going to hurt yourself by doing these next parts, this next release, and see how you go. I have a couple of different balls here. Now, the larger one is a little bit softer in terms of more surface area, so it's not going to be as localized or as intense. It's not fully inflated, and that's important because we don't want to be bouncing off it. The smaller one is kind of a little bit more localized, can be a little bit more intense. And all we're going to do is we're going to come down onto our belly and we're going to pop this ball in our belly. Some of you might feel comfortable with your elbows down on the ground, your shoulders are relaxed. Some of you might feel more comfortable here. That feels quite intense for me. So I kind of like it, just up here. And what I'm trying to do is I'm trying to soften and relax my muscles, relax my pelvic floor, relax my breath, my shoulders, my neck, and allow my body to try to inflate my lungs, inflate my diaphragm while there's a physical barrier. And this barrier is kind of soft, but for some of us who have tension here, it can feel quite intense. So I feel this relatively intensely. I do have some core tension. I've been up in my training. It's a bit at the moment. So I'm really noticing that it's quite hard to breathe and relax onto it. And I don't want it to be too intense. Pain is a sign from your body that it's too much. So any kind of super intense pain signals come right off that ball. But if you can manage it and if you can start to turn that down, we're just going to take a little wiggle. And as you notice, the ball is pretty high up in my diaphragm at the moment. That's where I feel like I need it. But, we can have it kind of right in the middle as well, like right over that belly button. And there I'm kind of noticing that I have some adhesions or some gluiness in and around my guts, for lack of a better term. And because your intestines, your stomach, all of your organs, your viscera are floating in a sea of fascial tension, which is what keeps them from like plopping on top of each other. Imagine that this ball is kind of gently massaging them into compliance, into a bit more freedom. The fascia between your organs can get stuck just like any other muscular fascia and or tension. And this is one of the spots in the body that we don't really get massaged, or we don't really focus on. But it's a muscular component to our body, just like anywhere else. In fact, most of your organs are muscular in nature, particularly your digestive tract. And this is where a lot of us hold a lot of tension as well. And these organs expand and contract just as much as any other muscle does as well. So I want you to think about it like that. Don't be afraid, that you're going to puncture something. That'll be quite a feat. It'd be a bit challenging. And so now I can really feel that I can ease into that. I can take that ball pretty much all the way down, almost over the bladder and the pubic bone there as well. And I find it much more relaxing further down, like right in that central part. I have endometriosis. I feel like that's where a lot of my pain is. So females, if you get a lot of menstrual pain, you might notice a lot of intensity there. Men, if you have a lot of bowel disruptions or anything like that, you might notice some things there as well. But now I should feel much more at ease, and I can feel like I can inflate and take a deeper breath. Now, the tricky thing here is we don't really know how much we need to kind of turn it down. So here's a couple of ways that we can try to check this. I'm going to come back to my position where I'm bent over and relaxed here. I'm going to let go. Does it feel a little bit more floppy and soft Play-Doh there? And to me it does. It's toned down quite a bit. So now we're going to do just a really basic core activation. Now, if you've never done Pilates before, I just want you to keep your spine on the floor, not pressing hard on the floor, but just connected to the floor. Your shoulders are relaxed. Keeping your hands on your belly, can you lift one leg with ease? So if your hands are on your belly, do you feel your muscles contract, or can you keep this relaxed tension, this relaxed space, and lift one leg, and that should be about a 2 or 3 out of 10 because you're barely using your core to be able to lift that up. It should feel very easy. Some of you might notice that to lift your leg, you might have to brace, but once you're there, can you turn it down? Can you do this easily? And my suggestion to you would be, if you find that really tricky, if you find that you're still gripping, it's going to take a little bit of practice, a little bit of manipulating and turning down with some balls, maybe some breath work, and calming that tension down, that chronic tension that you have there in your spine, in your belly, in your obliques. But if it did turn down, if it was nice and simple, then we know that we're in a really good place now to add more movement, add more intensity to our body, and it will be able to start to turn on the core more gradually. And that's a really nice starting point for any workout, particularly if you come in to a workout, you're feeling really stressed and really on, and you're in a little bit of pain. Hopefully it's just helped to down regulate some of that pain, some of that tension, and now you're able to move forward with it.
I don't want you to miss out on future episodes of Meant to Move. When you subscribe or follow this podcast on your favourite listening app, you'll be the first to know when new episodes are released. You'll also never lose your place in an episode if you need to leave early. So go on, join, and subscribe to the community that's committed to holistic health and wellness. Let's move forward together.